In our discussion about the antacids, we will cover topics including the antacids types, therapeutic uses, adverse effects, and drug interactions. So the types of antacids available are the aluminum hydroxide and the calcium salts, the magnesium salts, and the sodium bicarbonate. Now, all of these antacids work by neutralizing the stomach acid, leading to the relief of the heartburn symptoms and the relief of the peptic ulcer pain. But every one from these antacids have specific features that differentiate them from the others. For the aluminum hydroxide, so the aluminum hydroxide works as antacid by the same mechanism as the other ones. It neutralizes the stomach acid and it also inhibits the pepsin proteolytic activity, leading to alleviation of heartburn, ulcer healing, and pyloric spasm relief. Now, in addition to its use as antacid, the aluminum hydroxide is also combined with the sulfated polysaccharide sucrose octasulfate to form the sucralfate. Now, the sucralfate helps healing the peptic ulcer by reducing the pepsin and the hydrochloric acid contact with the ulcer, and the sucralfate will be explained in more details in a separate video. Now, the aluminum hydroxide is also used in treatment of hyperphosphatemia because of its ability to bind phosphate in the gastrointestinal tract, leading to inhibition of the absorption of the phosphate. The other antacid we have is the calcium salts, specifically the calcium carbonate, and the calcium carbonate work by neutralizing the stomach acid and by inhibiting the pepsin proteolytic activity, and it also works to increase the lower esophageal sphincter tone. Now, the calcium released from the calcium carbonate work also to increase esophageal peristalsis, leading to pushing the acid in the stomach and providing relief from the heartburn symptoms. Now, the calcium salt also bind the dietary phosphate, same as the aluminum hydroxide did, and this would lead to prevention of its absorption. Now let's talk about the therapeutic uses of the antacids. So the antacids are over-the-counter medications, and currently their use is restricted to relieving the mild intermittent gastroesophageal reflux disease, the GERD, because the GERD gives heartburn symptoms, and by administering the antacids, they work to relieve the heartburn symptoms. Now, previously, the antacids were the first-line treatment for peptic ulcer disease until the proton pump inhibitors got discovered, because when the proton pump inhibitors got discovered, they revolutionized the treatment of the peptic ulcer disease, and they became the first line in treatment of that disease because they have much higher efficacy than the antacids. And the antacids stopped being used for peptic ulcer disease. Now let's talk about the adverse effects. So the antacids lead to a wide range of side effects, and the calcium carbonate specifically may lead to hypercalcemia because it contains calcium. It may also lead to abdominal pain, and it may lead to anorexia, acid rebound, which is increase in the acid secretion when the medication action ended, and it also may lead to nausea and vomiting, flatulence, dry mouth, headache, hypophosphatemia because it binds phosphate and prevent its absorption, and it may also lead to milk alkali syndrome. Now, the milk alkali syndrome is a triad of elevated calcium levels, metabolic alkalosis, and acute kidney injury. Now, the milk alkali syndrome associated with consumption of large quantities of milk and calcium carbonate for peptic ulcer disease. Now, the milk work to buffer the stomach acid, same with the calcium carbonate. That is why they are used for peptic ulcer disease treatment, but overusing them together would lead to the milk alkali syndrome. And patients who have osteoporosis and patients with chronic kidney disease have a high risk of developing this syndrome. Now, if this syndrome is not treated, it may lead to acute kidney injury and metastatic calcifications. Now, the antacids that contain the magnesium may cause diarrhea, while the antacids containing the calcium or aluminum may cause constipation. And the antacids overuse may lead to acid rebound. Now, it is important to understand that the aluminum containing antacids may lead to aluminum toxicity, and the aluminum is a heavy metal. Its use in individuals with renal failure and infants is associated with increased risk of toxicity. And aluminum toxicity present as osteopenia, microcytic anemia, neurotoxicity because the aluminum deposits in the neurons, and it also may lead to osteomalacia, constipation, fecal impaction, nausea, vomiting, abdominal cramps, hypomagnesemia, and hypophosphatemia. Now, finally, let's talk about the drug interactions of the antacids. So the antacids impair the absorption of the acidic drugs. Examples: the digoxin, the chlorpromazine, and the isoniazid. And this would lead to a reduction in their blood concentrations and failure of therapy. And the antacids can increase the absorption of some drugs. Examples: the pseudoephedrine and the levodopa, leading to potential toxicity and adverse effects. And the antacids containing magnesium salts can bind to drugs like tetracycline and fluoroquinolones antibiotics, preventing their absorption. And the sodium bicarbonate increase the urine pH, which can alter the renal elimination of some drugs, leading to inhibition of elimination of basic drugs and increase the elimination of acidic drugs. And with that, we reach the end of this video. Thank you guys for watching. Please give us a like, comment your ideas and questions, and subscribe.